Hello everyone, I Tarak Makadia, along with my team members Manjot Kaur, Nikin Mehri, Pooja Mistry, would like to present a case study analysis on rollout of rapid diagnostic tests for malaria in Swaziland. So this is the brief overview of the topics that would be covered in this case study analysis, that is abbreviations, summary, background, roles and responsibilities, timeline, problems, solutions and recommendations, organizational change development, conclusion, references. The important abbreviations that would be frequently used in this analysis is NLS, that is National Laboratory Services, NMCP, National Malaria Control Program, and RDT, that is Rapid Diagnostic Test. To give the brief overview on this case, it is in 2011, Swaziland became the first nation in sub-Saharan Africa to adopt a national malaria elimination strategy. As per NMCP, the use of rapid diagnostic tests for detecting malaria was the center of focus to boost the national malaria surveillance system and improve case management in Swaziland. The key issues encountered by the management team led by Simon Kunin were program funding, communication barrier, procurement and distribution chain. This case also highlights the leadership qualities of Simon Kunin, the program manager of Swaziland (NMCP), and his detrimental efforts to lead the team of healthcare service providers from both public and private healthcare services. Kunin thought the prevalence of malaria was overstated before RDTs were introduced in Swaziland, particularly at the clinic level where microscopy services were not immediately accessible. The patients received anti-malarial therapy even before they could get the confirmation on their blood samples, as the lab testing microscopy to detect malaria took more than a week. The case includes data on the RDT selection process, Swaziland's quality assurance program, the first of its type in the area, and the advantages of the swift disease reporting system for active case identification for public health. The significance to increase the funding and adjuncts to provide training programs that acquaints the healthcare service providers outlines strategies in implementing this new approach of case management. Next slide.
So, talking about the background of this healthcare organization. National Malaria Control Program of Swaziland is a healthcare organization which is led by government. And according to our research, NMCP's organizational culture type is adhocracy, which represents flexibility, creativity, and organized decision-making process. So some of the characteristics of Swaziland NMCP is, which is already mentioned, is government-led, like any other national malaria control program. And the second one is a strategic planning, which the NMCP develops strategic plans that outlines the goals, objectives, and key interventions for malaria control. Partnership and collaboration. The NMCP collaborates with various stakeholders, including international organizations, non-governmental organizations, research institutions, and communities. And the last one is prevention and control interventions, and also diagnosis and treatments. So in the next slide, I'm just showing you some of the roles and responsibilities from different members of the NMCP organizations in different levels. Talking about the timeline of the NMCP Swaziland in the next slide. So Swaziland was awarded the worldwide grant in 2008, which was defined a set of essential elements in the Global Malaria Action Plan for reorienting health systems toward the elimination of malaria. The second was that the NMCP educated 400 healthcare professionals from the private and governmental sectors in 2009 on the improved diagnostic and treatment standards. Then the nationwide rollout of RDT in both public and private health facilities was initiated in 2010. Later in February 2010, All private and public health facilities throughout Swaziland began offering free RDTs. And then in May 2010, the Swaziland Malaria Elimination Advisory Group was established to provide technical expertise and guidance for the elimination. The Ministry of Health established an urgent illness reporting system, which was called 977 Hotline, for healthcare professionals to report notifiable diseases such as malaria, like in times of outbreaks, and enhance information sharing within the healthcare system. So the result was that Swaziland became the first sub-Saharan African country to achieve malaria elimination. Talking about the problems. So the first one was funding the malaria response. After making a significant progress in malaria management, there is a chance that policymakers could lose interest, which might be harmful since malaria could reappear again. And secondly, a well-structured strategic plan is crucial to obtain financial support from the government and also the donors. And the next one was RDT distribution, which the National Laboratory Service, NLS, took over the National Malaria Control Program's role in collecting and distributing rapid diagnostic tests, RDTs. However, delays in the stockouts resulted because NLS capacity did not keep up with the demand. Besides, monitoring, quantifying RDT consumption was necessary to ensure proper usage and forecast supply. The next one was communication problems because inconsistencies between malaria cases reported by HMIS and those confirmed by NMCP caused issues. The number of reported instances decreased once RDTs were introduced. Also, accurate reporting and confirmation remained essential. So additionally, it was difficult to involve private sector clinicals in data gatherings and training for malaria. The NMCP held seminars, trainings, workshops, like mentorship visits, but the problem was that the availability of private sector practitioners. And last but not least, as the incidence of malaria dropped, health awareness plans became significant. It was necessary to emphasize public knowledge of the benefits of utilizing bed nets, getting treatments as soon as possible, and the availability of free diagnosis and treatments.
Now, what's next? I will explain solutions and recommendations. And the first challenge discussed was funding the malaria response, for which following solutions and recommendations can be provided by Mendes et al. 2009. First solution is seek diversified funding sources. To get more money for the malaria response, it is advised that partnerships be looked into with international organizations, NGOs, and business sector organizations. Second one is encourage more government spending. I recommend to engage with decision makers and make a strong case for further government financing by highlighting the financial health advantages of eradicating malaria. Now, in the next slide, it is RDT procurement and distribution, for which following solutions and recommendations can be provided. First solution is strengthen supply chain management. I recommend to implement reliable systems for RAD for forecasting, acquisition, and distribution. Form alliances with trustworthy suppliers, streamline inventory control, and enhance transportation logistics. Second is utilize technology. It is advised to investigate the use of digital tools to increase data accuracy, streamline the procurement and distribution process, and provide real-time monitoring. Examples of such tools include inventory management software and mobile applications. The third challenge is communications, for which solutions and recommendations can be provided as first is make use of several channels. To effectively spread information regarding malaria, I recommend to use a combination of traditional and digital communication channels, including radio, television, social media, and community involvement activities. Second is work with regional authorities. I recommend to work with powerful people to act as advocates and spread knowledge about malaria prevention, testing, and treatment. Examples of these people include recognized community leaders, religious leaders, or medical experts. Now, how can that changes be brought? For change, Dixon and Thal 2020 provided steps like assess for change, prepare for change, plan for change, implement the change, sustaining the change, and success. Here, focusing on organizational change development, leadership, and managing complexity can help in elimination of malaria. Now, when we talk about organizational change development in the next slide, as the mentioned solutions need to be in service, there is need for organizational change as well. Following are some organizational change development techniques proposed by Rick and Quinn in 1999. Create a change management team to coordinate the execution of suggested solutions and promote communication within the company. Second is encourage staff to offer suggestions and solutions, offer training and rewards for innovation, recognize and celebrate effective changes to promote an innovative culture. Third is implement a thorough monitoring and evaluation framework, gather feedback from stakeholders, and use data-driven insights to inform additional changes and modifications as company monitor and analyze progress. Now comes to leadership in the next slide. The leaders can drive change and combat challenges who focus on following criteria. First is vision and anticipation. Leaders should be aware of the necessity for change and have a clear vision of the intended result. They should foresee possible difficulties and openings so they may be proactively handle them. Communication. Leaders must convince all stakeholders of the change vision by effectively communicate it to them. They must be adept at communicating the significance of the shift and the advantages it offers. Engagement and alignment. Leaders should motivate and coordinate teams and individuals to work towards a common objective. To encourage a sense of ownership and commitment, this entails actively incorporating stakeholders, addressing issues, and soliciting input. Last is support and resources. In order to promote change, leaders must offer the necessary help and materials, budget distribution, ensuring sufficient staffing and training, and removing roadblocks to growth can all be part of this. Now comes to next slide about complexity. The following observations might be taken into account while tackling the complexity of organizations and leadership in context of the malaria challenges. First is understanding complexity. Leaders must recognize the intrinsic complexity of the malaria challenges and know that simple linear solutions can be used to solve them. They must recognize the complexity of the issue, which includes socio-economic variables, healthcare infrastructure, cultural norms, and environmental considerations. Second is systems thinking. To understand the interconnectivity of the different components engaged in the fight against malaria, leaders should take a systems thinking approach. They must comprehend how alterations to one component of the system can have repercussions on other parts as well. This viewpoint enables more comprehensive decisions and interventions. Now, conclusion will be explained by my teammate Pooja.
So, in a conclusion, Swaziland use of rapid diagnostic test for malaria has made a substantial contribution to the improvement of malaria diagnosis and treatment in the nation. There have been several successful and positive results in the use of RDTs. After doing the case study, there are few important points I would like to mention in a conclusion. First is enhanced accuracy. RDTs have established themselves as a trustworthy method for diagnosis malaria, delivering precious finding quickly. This had made it easier medical professionals to recognize and efficiently treat malaria cases. The second one is improve access. So access has been improved because to the installation of RDTs, especially in a rural and underserved part of Swaziland. This has made it possible for more people to get quick diagnosis and the right treatment. The next is about reduce over treatment. RDTs have helped to cut down the overuse of anti-malarial medications. RDTs have aided in preventing medication abuse and the development of drug resistance by identifying the presence of malaria prior to start the therapy. The next is cost effectiveness. Using RDTs to diagnose malaria has been shown to be co-effective strategies. RDTs are easier, quicker, less expensive, and need less infrastructure and training than conventional microscopy, making them more accessible and available to medical institutions. Better monitoring and surveillance of the illness are now possible because to the widespread of RDTs, which has made it easier to gather precious data on malaria cases. This information may assist direct to Swaziland malaria control initiatives and advise targeted actions. It is essential to continue funding the implantations and scale up the RDT in order to further improve malaria control efforts and move toward to goal eliminating malaria in the nations. Overall, the rollout of RDTs for malaria diagnosis in Swaziland has improved accuracy, access, cost of effectiveness, and surveillance. By implementing this solution, recommendations, and embracing effective leadership practices, the MNCP in Swaziland can overcome the identified challenges and make a further progress towards the malaria eliminations. The next slides is about the references. Thank you.